There's something important out there. We've noticed a rise in sensitive skin. Are you someone with sensitive skin? Skin that stings or burns when you put anything on it? A cleanser, a lotion, even a sunscreen? This is something new that we're experiencing. It could be from overuse of products. We have people out there getting peels and peels and peels, and they've overdone it. They've stripped the barrier. It may be people who have a history of eczema or allergies, so their skin tends to be more sensitive. So there's lots of reason for the sensitive skin syndrome. For that, we've created Soothe. It's the right way to cleanse your skin, and it's the right way to restore your barrier, and always, as important, the right way to get that sunscreen on so that you're protected from further assaults in the environment.
Before we tell you what's in Soothe, let me tell you a little bit about what's not in Soothe. First of all, we don't have any alcohol in these products. Nothing that's going to further strip and dry out the barrier of your skin. We don't have surfactants. Surfactants are soap. We have non-soap containing cleansers. There are no colorants, there's no fragrance. So it's going to help to restore and heal your skin while it's taking away the redness.
I do not wear makeup. I don't like to wear makeup. I don't like the feel of it. I'm working close with clients. I'm sweating. I don't have time for that. I can't worry if it's going to move around on my face. So finding products that help keep my skin together has everything to do with me in the world. Projecting an image of health and having beauty as part of it is important. It smells beautiful. It smells like chamomile. Last winter, my skin started having red patchiness, dryness. I couldn't really tell why. I figured out it was the climate. It was going from the cold outside to hot inside. And I started having redness and dry, and it hurt really bad. And a friend of mine told me about Soothe, and I used it. And 2 to 3 days after using it, my skin, the condition of my skin, improved dramatically. So I never really thought about the fact that I might have sensitive skin, but I do.
Now let's take a minute and tell you a little bit about what the products are.
This is an extremely gentle cleanser. It'll get the job done of getting off the oils and all the sunscreens and all the environmental insults for the day, including your makeup, but it'll leave the skin feeling robust and not dried out and too tight. So this is the right cleanser because it begins to restore that barrier. In step 2, very important, this is loaded with ceramides and barrier repair. And what this does is really nourishes the skin and brings back that natural biofilm that truly belongs on the skin. Number 3 is the right sunscreen. There are sunscreens that can actually cause irritation with sensitive skin. Those of you who have it know you can burn and sting with that application of sunscreen. So we needed to get it right because you're not getting away without it. You gotta have the sunscreen.
It also has dimethicone. Dimethicone is an FDA-approved skin protectant agent. Critical in repairing that barrier. Remember, it's that barrier that's missing. That's why your skin is losing moisture and stinging and burning and turning red.
We've got it so you don't have to go and figure it out. The most important thing is your comprehensive ritual is right here every day so you never get it wrong. It's the right way to cleanse your skin, and it's the right way to restore your barrier, and always, as important, the right way to get that sunscreen on so that you're protected from further assaults in the environment.
I can imagine the kind of research that went into these products is that these 2 women doctors who don't want to wear makeup, they want to be liberated from foundation. They researched everything that's out there, and they came up with exactly what they want to use on their skin. They're using real medicines on a very light dose. They're using botanicals. They truly are looking at what skin needs, what the condition is of the skin, and addressing it. And I think they've come up with superior products.
Now on that one day, maybe it is stress in the office, maybe you've been out in the sun, we have the step 4.
Which is a hydrocortisone containing product. What is hydrocortisone? Well, it's an FDA-approved anti-irritant ingredient. It's good for itchy, red, dry skin. So if you get those little areas where your skin is a little bit rashy, you can use this. We call it our PRN cream. PRN in medical lingo means as needed.
I had a really bad burn over here. You can see it's almost gone. Sometimes I get a rash on my forearms, and I just use a little bit of this. It's a really nice, easy, light cream. I've had sunburn on my hands from mountain biking, and I did a test, and I put Soothe on one hand and not on the other hand, and within 10 minutes the purplishness of having that sunburn was gone. So I knew, I knew the dramatic results of Soothe.
One of my favorite stories is my own husband. As a man, he never applies anything on his face. He shaves, he's done, unfortunately. But he gets redness on the face, and you can see his skin change when the weather changes or he's under stress. With the Soothe regimen, he's been using it, and he's had the best 2 years of our 20-year marriage. His skin has just been gorgeous.
Being able to use skincare that brings the condition of my skin, keeps the texture of my skin right, keeps my complexion even. I mean, it's really beautiful. The Rodan+Fields, all of their products are exceptional. They do what they say they're going to do. They have real medicines in them at very light doses, and you can really completely treat your skin.
Now we're going to talk about reverse. You know, reverse is going to help probably about 80% of all of you who are watching right now, because reverse treats one of the most common problems that we see in our practices, and that's hyperpigmentation. And let me use myself as an example. I grew up in Southern California, baking my face on the beach. That was before I became a dermatologist. And so reverse was a very important product for us to create, because I wanted to get rid of my own brown spots. I wanted to get away from all that heavy foundation. So after using reverse, I can go naked. In fact, I don't have any foundation on my skin right now on camera. And a lot of people may not believe it, so Dr. Fields is going to prove it. She's got the white glove. No foundation. Now,
That's naked.
It is. And you know what? That's skin that feels great. It's skin that's kissable. It's skin that doesn't put a mask between you and somebody else.
Now let's meet Fabrina, who's on Rodan+Fields Reverse.
Everywhere I go, people ask me what makeup line I use, and I said I don't use any makeup. I only use eyeshadow and lipstick and blush. I don't use any foundation or powder, and they just couldn't believe it. And when they don't, I just grab a tissue and wipe my forehead and chin and show them that I don't have any powder on or foundation on. It was right under my eye, right eye, it was darker. Before I used the product, my skin looked tired. After I use it, I noticed that my pores become smaller. It looks smaller. Not only the size reduced, but also the color, the darkness of the sun damage reduced as well. Definitely the difference is smoothness of the skin, and just felt great.
Now the question is, well, why does this work? What makes it special?
Well, what makes it special is really based on the 20 years of experience that we've had in our practices treating patients with these types of problems. In my practice, I use something called a UV camera. What does it do? Well, it takes a picture of your skin at a deeper level, something that you really can't see, and it explains why you have the blotchy discoloration. Again, these are not necessarily visible when you look at somebody in real life. But what you see are the uneven pigmentation, the discoloration. These are a result of past tans, past burns. Also, the discolorations that occur, especially around the lip, from a pregnancy, from the estrogen that is surging during your pregnancy. And all of these discolorations can be reversed. This is the area of your skin that we're treating. Remember, we're treating from the inside, and that's thanks to the medicines that are in our program.
Actually, I was not the one noticing it. Actually, my sister did. She asked me what I use, and I told her the product, Rodan+Fields Reverse, and she asked me to get a regimen for her, and she did try it as well. Then end up all of my sisters use it as well.
Pretend you're looking at your skin. What you see, that freckle, is just the tip of the iceberg. What's really happening below the surface after years and years of sun tanning is this pigmentation, this muddy lake appearance of these spots under the surface. So just treating the dot won't work. You have to treat the entire face, chest, and hands to really see significant improvement all the way through the tissue.
When you have problem on skin, you go to see a dermatologist. But why spend money to go for and pay for a doctor visit when you can get the product over the counter? I mean, they're just the same products which your dermatologist will prescribe you.
Our whole mission is about helping to heal your skin. We want to treat your skin from the inside out. We don't want you to cover up these problems. We want you to get rid of them so that you can be free from having to wear foundation. And you can use makeup for the fun of it, not because you have to use it. So how do we achieve that? Well, we do it in a system. Why? Because that's what's worked for our patients. We start with exfoliation. We got to get cells turning over, got to help lift that abnormal pigmentation, and then allow better penetration of the medicines that follow.
With this product line, with Reverse, you really enjoy using the product, and therefore you stay on it, and then you see the changes.
Feels good. Skin feels gently massaged, and then it feels clean. Doesn't have the stinging sensation. It's really gentle and feels good.
The next step is the toner. This is not just any ordinary toner. It contains hydroquinone. Hydroquinone is the only FDA-approved medicine that lightens and brightens abnormal pigmentation. What is hydroquinone? What it does is it's a tyrosinase inhibitor. Big word, but it blocks the production of pigment that's down at a deeper level in the skin. You treat the whole face, again, because we want to treat all the discolorations, even those at a deeper level.
It's all about treating your whole face.
Pick it up from there. Then there's step 3. Very important. Follows 2. It is the lotion, also with medicines, hydroquinone, but all the extracts you read about, the bearberry, the licorice, the retinol, to help that cell turnover.
It feels citrusy, moisturizing.
Then sunscreen in the morning. So essential. This whole system is a waste of time if you walk back outside, even if you're going to jog at 4 a.m. or 7 a.m., whenever the sun is coming up. So very important that you wear sunscreen every day. Every day is sun day, so you want to get the best results. It's the right sunscreen for your skin.
And this is a 2-month supply, and you're going to start to see results within 2 months, probably even a little bit sooner. What you're going to notice in the first week is your skin is getting brighter. It's getting pinker. It's starting to get more even. The brown spots are going to begin to fade in the 3rd and 4th week, and by the 8th week, you're going to see a real improvement in your skin.
It's important for people to know they may be using many systems because they have several problems. Because of the color coding, the whole thing, again, our philosophy is keep it simple. The right medicines that work so that you get that change. So what have you learned? What is it about the Reverse regimen that's going to work for you? The Reverse regimen for brown spots and pigment problems contains smart science. We have the right ingredients for the cleanser. It exfoliates. We have lactic acid to help remove that dead skin and get the skin going. Then we have in the toner and the lotion things to really help lift that abnormal pigment. And of course, you've got to have sunscreen, and we have the right one. This is full face every day to help improve that color on your face, chest, and of course your hands.
And the end result is that your skin looks brighter, it looks healthier, it looks more youthful, it looks more even in color. That's the desired goals, and you can achieve it with the program.
It helped me, so I want to share my experience and the knowledge how great the product is so that other women can experience the same great results that I have.
This, of course, attracted my anti-aging system here. This helps, according to you, reduce wrinkles. What kind of testing have you done? Is it on all skin types?
Yes, all skin types. Anti-age is the right combination of peptides and barrier repair and cell turnover, all packed into a simple system, so you don't have to go figure it out.
I think it's so fantastic that we can erase and get rid of skin issues with medicine so that you don't have to rely on foundation. You can let your beautiful skin show.
We know that there's a lot of frustration out there. Every day you'll open a new magazine and something's coming at you that's going to save your skin. Well, the truth is, it really takes a comprehensive regimen that you do every day, your ritual that's going to get your skin from here all the way to there in the best possible condition. So we're going to give you the best secrets that we've learned over 20 years of dermatology, getting just the right combination of ingredients, not just one miracle cream that suddenly you saw yesterday. We're going to give you the right things that are going to be tried and true for the long haul.
And what you just mentioned about taking a comprehensive approach, it really requires that. Why? Because aging is a complex issue. What's happening in the skin that's causing those aging changes? First, in the epidermis, your cells aren't turning over as rapidly. What takes a 25-year-old 28 days to turn itself over and renew itself in the epidermis would take a 50-year-old 50 days or 60 days if I didn't do something about it. Next, in the dermis, we're losing collagen. After the age of 30, you begin to lose collagen at the rate of 1% per year. That's a lot. So we approach aging as a challenge. We want to address each one of those issues with our program.
You were in high school, right?
Yeah, that was a long time ago.
This is my sister's. I think I'm just at a time in my life where my kids have been raised, and it's a time when you can be a little bit more selfish about taking some time for you. Basically, I just wanted to look good for being 52. I noticed that my skin wasn't looking its best anymore. You start to look kind of like your face is hanging and baggy, and that's not a good thing. You want tight, firm, smooth, poreless skin.
Patients come to see us every day with just those concerns. And we as women, and we are dermatologists too, but as women, we care about that. So what we've created that we're so excited to share with you is our anti-age regimen, which is our answer to the treatment of fine lines, wrinkles, crow's feet, and loss of firmness.
All right, step one, the right cleanser. The right cleanser is an exfoliating cleanser with fine beads that help to stimulate cell turnover, unplug those congested pores, and bring out the brightness in your skin. So it's shedding the dead layers that should come off and then opening that door so that the next layer, the toner, can kick in. With our toner, the energy's in there. By giving your cells that boost, they can start to get those chemical reactions going again. It's also leaded with the antioxidants and the hydration that you need. And then finally, the third step is a real mix of everything that we've researched. It's the smart science in skincare. Peptides, not a few, a lot of peptides will go into that technology. It also has dimethicone to repair and protect the skin barrier. It also has sun protection. Most important, if you go out with the wrong sunscreen, you can end up doing further damage. So the right sunscreen, the right peptides, the right antioxidants, all in one deck, easy to use every morning.
I actually enjoy the getting up and doing the regimen on myself. I just take 5 minutes. It feels like I'm taking 5 minutes for myself, and it feels like I'm really nourishing my skin.
So I want to share with you a little bit about the peptide technology because it's very important for building that collagen back up and helping to reduce the length and the width of the wrinkles on our skin. What are peptides? You're probably wondering that. Why are they so important? Well, peptides are small protein fragments. They're the building blocks of the skin. That's what makes up collagen. And remember how important collagen is? By giving your skin these small protein fragments, we are triggering that collagen production. The cells, specifically called the fibroblasts, they begin to produce new collagen. We are building collagen rather than watching it just kind of fade away. And that's what helps to reduce the length, the width, and the number of wrinkles in your skin.
I will be using something with peptides forever now because I understand what it does for your skin. It increases, it stimulates your collagen. And if you don't stimulate it, it'll just fade away. So I'm going to try to not let that happen. Your skin feels smooth and feels very different. I love the way it smells. It just glides on your skin. You know, inside your head, you're still the same old person, and you don't age. Your personality doesn't age, and this helps your skin not to age.
Have you ever found yourself looking in the mirror and doing this? You may be missing the skin of your youth.
That's because young skin has ample amounts of collagen and elastin fibers to keep it firm and supple. But time and the environment take their toll.
As we age, the production of these fibers slows, accelerating the breakdown of skin supportive proteins. The results are sagging skin with wrinkles and enlarged pores.
We don't want to see that in the mirror, and we know you don't either. Born out of our own needs and based on our experience with our patients, we created Redefine.
This comprehensive collection of skincare products and tools is clinically proven to combat the visible signs of aging. It all starts with our Redefine regimen and our philosophy of multi-med therapy. It's not about an ingredient du jour or cream of the week. Redefine is a steady diet of intelligent skincare that combines efficacious cosmetic and active OTC ingredients in the right formulations, at the right concentrations, and in the right order to visibly transform skin. The result is smoother, more even, younger-looking skin.
We're taking a firm position on the visible signs of aging with our AmpMD system. In just 1 minute a day, AmpMD, with its tiny microneedle tips, conditions the outermost layer of skin for advanced benefits. Used along with our Redefine regimen, the AmpMD system helps you achieve visibly firmer, more youthful-looking skin. We tell our patients, don't ignore the visible signs of aging, take control. And now you have the tools to do just that.
This is Aging Redefined.